I'll record to this computer. Good evening, everybody. Welcome to Applied Neolife for today, Tuesday, the 27th of September. It's the last Tuesday of September, and as we approach the end of the month, I trust you are all excited about your goals that you are working on, and I wish you all the very, very best for the new month and for the month end, obviously. Today, I wanted us to talk about nutrition in ADHD and autism, and I've been very specific because I don't want us to be under any illusions that we can cure these conditions. However, we can make a difference, and our mission is to make the world a healthier and happier place. And so we would love to know that we can make a difference to the lives of children and adults with attention deficit and hyperactivity and autism spectrum disorder. My name is Dr. Esa Zanambasi. I'm very, very passionate about what we do in Neolife, and that's why I've called my series Applied Neolife. Now, all of us parents have situations such as this where we are at our wits' end what to give our children, what is healthy and what isn't. And in this day and age, I must tell you, it is very difficult. So let's start with ADHD, attention deficit hyperactivity disorder. It is described more than defined, okay? So it is described as a disorder in which there is difficulty paying attention or controlling behavior. And the three aspects of it seem to be hyperactivity, attention deficit, and impulsivity. And you know, it has become almost mainstream conversation for the past few years. But I must say, when we went to medical school in the 80s, we did not have this condition. we were not talking about it as much as it is talked about today. The amazing thing is they say anywhere between 5 and 10% of children are affected by it, but that also depends on where the estimate is made and by whom it is made. And of late, we've had a lot of people who right. I believe we should be concerned because, and this is a big concern, we entrust our children to the education system, hoping that they will come out and be self-sustaining, if I can call it that, citizens who are able to take care of themselves and to earn a good living. But a lot of that depends on acquiring a good education first. So why we should be concerned is that ADHD and autism spectrum disorder, you'll see the connection actually, is it affects the ability to acquire these skills, such as numerical, coordination, reasoning, and human perception, which there's a psychology theory called Gestalt or Gestalt theory, which outlines how we are supposed to be able to perceive as human beings at several levels and to be able to simplify our perceptions so that they make sense to us. And among them is the ability to visualize our preferred future. So if people can't do that, then it will affect a lot of people's ability to move ahead in life as we would like to define it. So, you know, that period of going to school for a child who has attention deficit or the autism spectrum disorder can be a source of trauma. It can be very traumatic and result in adverse childhood events, which will later reflect in life. Now, I just want to welcome all the guests and even the distributors, and just to say, the reason I started doing these sessions was not so much to give lectures as more as to get us to think on a broader scale. So sometimes I go off at what appear to be tangents, but just stick with me, please, and connect those dots with me, and we'll get somewhere together. But yes, we should be concerned because it will affect the children, not only during the time that they're children, but well into the future. And so a lot of trauma can be caused. And I just want to give an example. They gave the example that it affects a certain percentage, about 5 to 10% of the children. But you can imagine if a child is always hearing comments about himself, like this child makes careless mistakes, not only from the teachers at school, but gets home and is told the same thing, or doesn't seem to listen, or this person doesn't follow instructions, or this child is disorganized, okay? Or doesn't even want to think, anything that makes him think he doesn't want, or is fidgeting all the time, or, you know, is impatient and rude, or too talkative. You know, we tend to make such comments without thinking about the impact they will have. So the reason I want to do this is to say, let us as adults introspect a little bit and perhaps look at ways to make the little people's lives more tolerable, and even to see where we ourselves are making an error. And that's what I want to apply our opportunity to. Okay, so what might be contributing factors? And there they are: sensitivity to various chemicals. We have done a lot of things on toxins and toxicity and chemicals, but among them are food sensitivities. You might even have environments with fungal spores and mold in the home or wherever the child is exposed to. It might even be at school. So perhaps we need to take keener interest in how our school environments are. And then they say that there might be a genetic component, but the epigenetics, and we've come across this word in several of the webinars, those are the things over and above the genetics, account for anywhere between 80 and 99% of disease presentations. The true genetic component is actually quite small. Now, I want to point out a special mention here, and that is a chemical that is very common. It appears in our water, but more importantly, it appears in our toothpastes. A lot of toothpastes have fluoride in them. Fluoride is known to be very, very damaging to the bonds that hold DNA together. And not too long ago, we described DNA as being in every single cell in our body because it is in the nucleus and it is also in the mitochondria. Okay, so that will lead to rapid cellular aging, It will also cause the overworking of repair enzymes and antioxidant enzymes like glutathione. Those go into overdrive, and that can be very damaging to the cells. Fluoride is known to damage the hippocampus. That is the area in the brain that is responsible for memory and emotions. That was mentioned very recently when we covered Alzheimer's disease. So the concerning thing is fluoride is most toxic to portions of the population with the greatest degree of malnutrition, such as children, and such as children who happen to be picky eaters and therefore are very difficult to get adequate nutrients into. And that's what we are talking about, ADHD and autism spectrum disorder, or autistic spectrum. So, and out of it is ADHD itself, ADHD, attention deficit hyperactivity. But then you might have others who are always anxious about something. You might have others who are depressed. You might have others who have specific learning difficulties or difficulty with auditory processing. They can't process what they have heard as well as they could, as well as they might. So it is a spectrum. It is a spectrum. And that's why when we have such a broad presentation and a broad spectrum, it is very often difficult to actually make a diagnosis, a definite diagnosis. So here's the question: is ADHD overdiagnosed? That's a debate that we can have. Yeah, everybody will have an opinion on that. I sometimes think so, and I'll give a little story here of a mother. Oh gosh, Namyaro, please, will you stop writing on my screen? I'm going to ask you to excuse me because we're going to have that. Okay. Okay, so the little story I was going to tell was of a mother who had her son rather, in a private school, and they were pushing her to start the child on medication. These were the teachers who went as far as saying that if they do not start the child on medication, the child would have to leave the school. So the friend of the mother came to me and said, "Doc, what can we give this child from the products that you know so well and you carry?" So we put the child on a children's program, and within about a month, the child settled down sufficiently to do well. And the teacher came to the mother and said, "You see, I told you, you had to start the child on medication." And all it was nutrition. The mother was so resistant to starting the child on medication, she didn't. And we applauded her dedication and effort. She had to go as far as changing the nutrition, making sure that she did everything right. And she saw results. So the question that you can debate after this presentation is ADHD overdiagnosed? Because diagnosis depends on interviews of parents and teachers, it depends on observation, it depends on cognitive and academic assessment sometimes. It might just depend on a teacher who is overwhelmed with the numbers of pupils and therefore assumes that the pupils need to be controlled medically. Yeah, so that is, as I say, something that we can debate. Okay, so let's just move swiftly on. What are some risk factors to know about the disorder? One is preterm birth or low birth weight, and also, of course, exposure to toxins during pregnancy, such as lead, smoking. We know some mothers in some communities carry on smoking right through pregnancy. Alcohol, yes, alcohol is a big problem, and it can present as what we call the fetal alcohol syndrome, where the person grows up with major challenges well into adulthood. Okay. I just want to let you know that if you are incapable of muting, I shall put you out of the room. I've just had to put somebody out of the room. So another thing is that we can conclude that pollutants and poor diets that poison and fail to properly nourish nerve cells and the brain are some of the greatest risk factors that we should know about. Now, can I implore all of us, those of us who are charged with raising children and perhaps looking after them in our homes, we need to limit or even try and eliminate the following things from the child's environment. Pesticides. Pesticides, you know, it is so tempting to use pesticides, granted, but you know, let me just describe what a pesticide does to an insect. It kills insects by powerfully activating the nervous system of the insect. So if any of you have ever seen an insect dying after being sprayed with a pesticide, it jerks several times because there are electric impulses that actually trigger convulsions in that insect until it becomes paralyzed and dies. Okay, so in children, this could be the trigger for ADHD and its presentation. The actual, it's just that a child is way bigger than an insect. Then the next thing is fluoride. As I have described it, it affects that area of the brain, which is charged with memory and emotions. And then recently we did heavy metals, lead, mercury, aluminum, cadmium. All those are quite toxic. And then the big one, refined sugar products. Now that is something that we have grown with over the years, but we need to rethink our relationship with refined sugar products because they cause wild fluctuations in blood sugar levels. And when that happens, when the blood sugar drops quite considerably, the blood sugar, then the nerves are more susceptible to damage by other toxic exposures. And so that up and down swing of the blood sugar is very, very damaging. And it might be the reason that the child presents with hyperactivity and attention deficit. And then there are chemicals that are known as excitotoxins that may be added to our foods. And again, for those of us who do, for mothers and business people who do children's parties as a career, food colorants, MSG, all those are very, very damaging. And then to all of us, I don't know how we'll escape this one, but we need to try and ameliorate it somehow. Excessive electromagnetic field exposure where possible. And then little people grow up into adults and they might carry on with the symptoms of adult ADHD, which look like that: anxiety, mood disorders, sleep disorders, autism, obviously, and then substance use disorder. I was listening to a presentation where the speaker said that if the child who has been started on medication for ADHD is not weaned off that medication by the age of 12, they are more, or 12 to 14 years old, they are more than likely to develop substance abuse later on in adulthood. Now, we don't want to be the reason that a child becomes a substance abuser, you know, recreational drugs. Okay, now let's swing to autism itself. I took one aspect of the spectrum disorder, but let's look at it generally. And because it is a spectrum, one can be very, very normal, or it can be what we like to refer to as high-end autistic. And it is a developmental disorder that impairs the ability to communicate and to interact. And so we're just creating awareness. We don't really have all the answers. We are all learning. We need to support each other in our quests for answers and perhaps ways to support each other and those affected. It's a combination of genetic and non-genetic influences. Factors that have been associated with increased risk include factors like pregnancy and birth complications. As I've mentioned already, extreme prematurity or multiple pregnancy. The factor that I found interesting to know was having another pregnancy in a very short space of time. You know, less than a year apart, a mother is pregnant already. There is likely to be an impact on that, on developing autism. And then another one that I found interesting was advanced parental age, either parent. But the commonality there is that the DNA, and that is the genetic component, might be that there is damaged DNA, but obviously the epigenetics come into play. So the risk is lower when there is adequate prenatal, in other words, before pregnancy and childbirth, adequate prenatal preparation to optimize the nutrition status. And we'll see how that comes into play. So symptoms and signs of autism include hyperactivity as well, ignoring or not being aware of danger, not being close to people, rejecting cuddles, and, you know, doesn't like to be shown love, okay? Doesn't tolerate sound very well, loud sounds, hysterics and temper tantrums and depression, and hyperspasticity, causing tiptoeing, or they tend to be spastic in their musculature. Their muscles are tight. And the main features: challenges with social communication, restricted repetitive behaviors. They tend to do things repetitively. Some will keep doing motions repetitively. And the symptoms and signs begin very early in childhood. So one has to be wide awake to notice. And symptoms and signs will persist and ultimately interfere with daily living. Now, why I say this, one has to be wide awake, is that many mothers, unfortunately, go to work, leaving their children in the care of other carers, either a helper at home or take the child to a creche or a preschool. And so this can be missed and only picked up later. And I now need to talk about early intervention, because the sooner it is picked up, the better the outcomes are. And one can institute speech therapy, occupational therapy, physical therapy. And if all those are begun at least 2 years prior to the school-going age, it is possible for the child to develop communication, cognitive, and social skills. There is a system called applied behavior analysis. That's an example of a system used in the autism spectrum disorder. So autistic individuals do not appear different physically, but because of their very difficult diets and picky eating and, you know, their lifestyles, they have a propensity to becoming overtly malnourished. So they might appear thin, they might appear outright not as healthy as eat a lot and become obese. But by and large, if everything is, all circumstances are stable and equal, they do not appear different. So let us bring in this concept, the importance of consistency for children and adults with ADHD and ASD, autism spectrum disorder. Yes, it is important to have consistency. So like in many things, the secret of success in managing those conditions is actually found in daily routines. Once routines are established, it is more likely that they will live a life as normal as possible. They would really enjoy that. And now, as we get difficult, and I'm going to now throw a curved ball and discuss an aspect of nutrition. But before I do that, the first line of management must be nutrition and a clean environment. And I say that in my capacity as somebody who is medically trained. We have the tendency to default immediately to the medical route without putting these important fundamentals in place. So I'm saying it with all humility that we must start with good nutrition and a clean environment. So as the family on a mission, the family that we belong to, we are on a mission to make the world a healthy and happier place for children with ADHD and autism spectrum disorder. We have a huge, huge opportunity to share with many families what we've got. We have a big, big responsibility too. And so society continues to prioritize treatment of symptoms. I repeated that our core message is that we must work on the fundamentals, and each child is unique and cannot be treated as every other child. That goes for whether the child is attention deficit or not. Each individual is unique. However, having said that, each child has basic needs for nutrition and a non-toxic environment. So let's talk about that. That is the core of our presentation. I want to talk about, and as briefly as possible, about oxalates. I will probably have to do another webinar specifically on this particular section of today's webinar. But in short, oxalic acid or oxalates are found in natural plant foods. They occur naturally in plant foods. Some foods have higher levels than others. So high oxalate foods include things like spinach, almonds, the potatoes, what some people call the Irish potatoes, tomatoes, wheat flour products, beets, certain beans, certain berries. And then you have foods that are low in oxalic acid or oxalates, which are listed over here. My favorite would be broccoli, and I'm so glad that broccoli is low oxalate. I'm saying cucumber is very alkaline and low oxalate. So just knowing the different foods can make a difference, because a study was done. It was actually entitled A Potential Pathogenic Role of Oxalate in Autism. And it revealed that there was a lot of oxalates in urine. This is called hyperoxaluria in autism. which seemed to suggest that there could be a disorder there where they can't handle oxalates very well. Now, what do oxalates do? They affect mitochondria. They cause a lot of oxidative stress, and this will manifest as inflammation. And if really severe, it can lead to seizures in autism. Then they are also associated with disruption of the gut, the gut lining and the gut microbiome. Those are the bacteria that live there. We've had quite a few discussions on that topic too. And once a leaky gut develops, then there's a lot of inflammation and a lot of deficiency of nutrients. So as you connect those particular dots and are wondering, oh my gosh, so there's more to autism and attention deficit than meets the eye. Yes, indeed, there's quite a lot. I was also amazed to see how much detail we need to go into to make the lives of the children better. So the main concern regarding oxalates is that they bind to trace minerals and other minerals as well, and to nutrients, thereby preventing absorption. One can call them an anti-nutrient, those oxalates. And indeed, they are in those plant foods to protect the plant food from being eaten by other organisms like animals, and chief of those animals being the human beings. So that's why they are in those plant foods. But then they will bind to calcium. They actually greatly bind to calcium. And as I say, I'll do another webinar on specifically on oxalates in the future. And then there's other metals. They even bind to heavy metals, which might be a good thing, but then you don't want heavy metals in you in the first place. And the other main concern is that they lead to the formation of kidney stones. So just remember that, park it somewhere in your mind. We nevertheless have to strike a balance where we are eating plenty of fruits and vegetables, but knowing which ones might trigger a child with autism. So there's this lady called Julie Matthews. She's in the United States of America, who has done a lot of work on nourishing autistic children. And she's written a book called Nourishing Book. So look it up on the internet. You might want to see it. But now let's come back to our opportunity and almost close off. I'll now go very fast. For the guests, we would like to let you know that Neolife is a company that really focuses on the fundamentals. So we have this wellness pyramid, which unfortunately, the nutrients that you heard me mention, refined sugars, inadequacy of the right fats, and all those. And then perhaps not doing the right activities to remain healthy has been the way modern lifestyle has gone. So a lot of people are quickly losing their health, and we want to show a way to rectify that. And Neolife deals with everything at a cellular level. And we know that if cells are unhealthy, then a lot of problems happen to those cells and to the health of an individual. So we have the flagship product that I want to introduce up front, which way back in 1958 showed that nutrition starts at a cellular level. And Neolife has it as a unique product to this company, and that's where we start. But within the cells are mitochondria, which have DNA, which can get damaged in the topic that we are talking about today, which is autism and attention deficit and hyperactivity. So Neolife thought about all that, and I want us to think at that level as well. And those are the people that we want to trust, because they have done the hard miles on our behalf, and we can now enjoy amazing products. And these are the core nutrition products for children. VitaSquares has vitamins and minerals, but importantly, it has TreaNN in it. We have the whole combination over there, including VitaGuard, which I will talk about. But let me talk about the importance of maintaining stable blood sugar. And you know, sometimes we think it is a small thing. It's okay just to give this child a lot of porridge in the morning, as long as the child is fed. But that is exactly what I talked about. Their blood sugar will shoot up and then come crashing down and expose those nerve cells in the brain to a lot of damage, and it will manifest as ADHD and autism. So wild blood sugar fluctuations cause nerve cells and the brain to become more susceptible to the toxins that we fear might be the reason. So please, let us not be afraid to give the child, if necessary, even if we work really hard to build our businesses to afford it, a shake, maybe a shake once a day or twice a day, ideally, because they are picky eaters. They are really picky eaters. And the idea is to develop stable blood sugar control within the glycemic zone so that insulin doesn't shoot up and blood sugar doesn't also shoot up, obviously, followed by insulin, because that is where inflammation happens when this kind of roller coaster is happening. Then we have others for the little ones, Liquivite. I'm not sure whether it's everywhere, but it's available. Then we have vitamin C. We have VitaGuard that I've talked about, very important. I've mentioned oxalates. We'll talk about them on another occasion, but those are actually free radicals. Free radicals are the ones that cause a lot of damage to the cells and to the DNA. And then, of course, we need to keep repairing and rebuilding nerve tissue. And so we need to ensure that there's plenty of omega-3 in the child's diet. Then the important vitamins, as a child grows older, might be able to swallow, very important for nerve function. And also it supplies the methyl donors. You might remember that from the past. And then important minerals. It is the deficiency of minerals in the diet that causes a lot of problems that we see in autism, and might be really deficient, as might calcium and calcium be. Calcium is a calming mineral, as is magnesium. Then, of course, vitamin A and D, very, very important, with the stress on the D vitamin and the A as well, which are both fat-soluble vitamins. And then, as they can, from time to time, we need to detox. Then, all of us should be in a position to make choices. We can control the environment by the choices we make. And I cannot ever stress this enough, that by eliminating toxins that can trigger those symptoms and signs, we need to become very, very intentional. And yeah, we had a good training on it earlier today, and so I will repeat it. So reducing toxic chemicals in the home is a priority. And then we don't use chlorine-based bleaches. Chlorine, fluoride, and iodine are in the same group, and that is very toxic. And so we use oxygen, which is an element that we all know we breathe and we need to live, and not chlorine and not fluoride either in our detergents. So why I'm saying that is that some researchers think that a lot of the problems also can be traced back to thyroid dysfunction, and that is another talk for another day. So your mind will always believe everything you tell it. And as regards the children and the children with ADHD and autism, we need to feed them hope. We need to feed them truth, and we need to feed them with love, just as we need to be feeding our minds and ourselves and each other. So let's do that. Let us create the world and help everybody to make the world a healthier and happier place. That is it. Thank you.